Good afternoon. Hi, I'm Bill Bird, Chief Medical Officer at CGH Medical Center in Sterling, Illinois. Thank you for joining the broadcast today. And so, how we're going to do this today is I'm going to give an update on COVID and stuff related to COVID here at the hospital in the area, and then I'm going to talk to you a little about about the video that I did here in the hospital, and then we'll talk about that when I get done with giving the COVID update. And as always, as I'm speaking, please send in your questions, and I can try my best to answer them for you. So I know that Rebecca, one of our staff in marketing, sent me a question that already showed up earlier, and it was, you want to put that up there, Rebecca, if you can? Yeah. Okay. So the question was how accurate are the COVID-19 tests? In particular, I think the person who was asking the question is there a chance a test could show negative and then go to a different site and test positive? And so here's what I would say about that. There's two different types of tests. There's a PCR test, which is the most accurate, kind of the gold standard test. And you're talking that if you test positive or negative for that, you're probably in the upper 90% ranges in terms of that being accurate. Does that mean that you could have a test that's negative and you could still be positive? Yeah, very small chance, but that's the case. At least in my experience here, like we've had patients in the hospital who we who sure seemed like they had COVID and they had a negative COVID test. When we repeated it, I can't think of a time when we repeated it and it's been positive, but it doesn't mean it couldn't happen. So I think clinically, if a person shows up and I see them and they've lost their taste and their smell, or one of those classic COVID kind of things, and I did a rapid test and then it was negative, I still have a pretty high index of suspicion. That being said, though, once again, PCR tests. If you're positive, you're probably positive. If you're negative, you're probably negative. There's another COVID test called an antigen test, and that's the one that you hear about. That you can do the test like a saliva test, and you can get the results back in 15 minutes or something like that. That test is right now, with the amount of COVID we've had in the area. By and large, if you test positive for that test, then you're probably positive, particularly if it goes along with having symptoms. You feel pretty comfortable about that positive result. With that antigen test, if you test negative, it is not a done deal that you're negative. And that's where if you did like a follow up, if you still had symptoms and still didn't feel right, you might still do a PCR test just to make sure. And sometimes that PCR test may come back positive. So I hope that answers our viewer's question. Thank you for that. While I'm waiting for any other questions that come up, I'm going to start talking a little bit about some numbers here in the area, and then talk about some vaccine stuff. So numbers wise in the area, at least for our hospital, we've now done 16,912 tests. 2,937 of those tests have been positive. 13,907 tests have been negative. In Illinois, we now have had, unfortunately, 1,046,030 positive tests, and 17,840 Illinois residents have so far passed away from COVID. In the US, there have been 23 million cases of COVID and 384,794 people have passed away. Pretty sobering numbers. And in Whiteside County, we're averaging about 22 cases a day. That's about 40 cases per 100,000. I kind of track that. Better than we were, but still way more than we were in March, April, May, June, maybe even July and August. We've had 5,133 confirmed cases here in the county and 134 deaths. Oh, thanks, Matt. So yeah, that's kind of where we're at in terms of, the case number is even up a little bit from what I'm reporting. So 5,265. And the deaths, unfortunately, no, they're the same. That's good. So very sobering. But on the bright side, we've had a little bit of a bump from the holidays, but nothing as bad as we were in early November, mid-November. So we're thankful for that. What I want to talk about now is vaccine stuff because I know that seems to be the thing that now that we've pretty well gotten the vaccine to most of the healthcare folks in our area, and I think we're approaching getting that to most of the nursing homes. The next phase is what's one is called 1B, which is you can look that up on the IDPH website. But in general, that it'll have the information. But one big bucket is people 65 years of age and older. That'll be on that list. And so, yeah, that's obviously something that folks are very interested in. I'm glad. I'm very glad that they're interested in. Just as last week, though, we are still working on a little bit of. I don't have a lot of details to share with you about when that's going to happen, where that's going to happen, how that's going to happen, who that's going to happen for initially. As I said last week, I think really soon we're going to have some information, but we don't have anything definitive right now. Okay, so Pat, thanks, Pat. Oh, I'm pretty sure, Pat, that if you had the first vaccine here at the hospital, that second vaccine is going to be available for you. And so I unless I hear it, we'll put something out there, Pat, on our Facebook and website if that's not the case. I know Pat's one of our volunteers, and yeah, and so Pat, we'll let you know. But I'm pretty sure you're going to get that second vaccine if you got the first one. That's been my understanding all along. Now, once again, for the folks who and Pat was referring to her husband, um, and yeah, for Mike, I would here's what you can do right now because we don't have any information that's really for sure. Here's what's going to go down. There are two places that you can sign in to get more information. Um, two places. So one is through the health department. They have a link. I don't know. We may be putting that link up ourselves through our website where you could download the health department as well. But basically, you can sign up on this health department link to get from the health department direct information once they have more details. There we go. There's something else just about the vaccine. But on the health department's website, you can get information about directly to you about when the 1B is going live and where it's going live, all those details. My understanding, if you sign up for that link, you just get it quicker than if you wait for it to show up on the regular news or something like that. So that's one place that you can sign up to make sure you get information as soon as possible about if you fit in that category and also the details. Second place is here at the hospital at CGH. You can call your primary care provider and just basically, if you just tell them I'm interested in the vaccine, we have a list. And there's been some confusion because we're trying our best to message this properly. But oh, thanks. Here's phase 1B. Thanks, Matt. So what we're trying to do here at the hospital is it's a list not that we're guaranteeing that you're going to get the shot and that you're going to get the shot in any particular order. I want to make that clear because I've heard some feedback that folks have called and their understanding is that they're on the list and so they're going to get the shot and they're going to get it in X number. That's not the case. What our list is an opportunity once again as we hear information about when 1B is available and the when, where, what, how, all that kind of stuff. We have once we have you on the list, we can then directly send stuff out to you as well about all the details. So I hope that clears that up. I know we've had some folks wondering about that. So those are the two places in terms of vaccine and latest and greatest information that you can register so you can get that information as soon as possible. I'm really excited for that 1B process to start. I know what I'm hearing is that the government, as I mentioned last week, is more and more wanting to get more vaccines into more arms as quickly as possible. so that we can begin to stem the tide of the infectivity rate across the country. I did read something today too that I thought was encouraging. So, you've heard about the Moderna and the Pfizer vaccines, which are their way of doing it is through messenger RNA vectors, and that's how they're getting the immune response to the folks that get that. Both of those, particularly Pfizer's, the storage requirements for that are pretty pretty strict. You have to keep it at a certain temperature and those type of things. Moderna still pretty impressive cold storage requirements, but not as much as the Pfizer. Johnson and Johnson, I'm reading where they're getting a good immune response in folks who are the volunteers who are taking that vaccine. And so almost everybody who's getting the vaccine is getting an immune response. I'm not certain of the numbers, what that means in terms of the effectiveness, but it seems like it's going to be pretty good. And the deal with the Johnson one is it's one shot and there's not the cold storage issues. So that may fall more in the bucket of what a routine flu shot is in terms of you just show up somewhere and they have it, you get the shot and you're done. It's a one and done type of thing. And I think that'll be really nice. I'm hearing that there's a chance that they're going to be asking for FDA approval fairly soon. So maybe the Johnson and Johnson could be available sometime in the next. I'm hearing like late January to early February. Obviously, don't hold me to that. I'm just regurgitating what I'm reading, but that sounds encouraging too in terms of vaccine availability. So I know this whole vaccine process has been messy, and I think we'll get it figured out. I think we'll start getting really soon a lot of vaccines in a lot of people's arms, which is great. And I couldn't be happier about that. I saw something there about under 65. So, Matt, would you put up the 1B thing again? Let's see what that says here. Education, manufacturing. Yeah. And so, right now, I think it was Dave that asked that question. Yeah. As I'm looking at this phase 1B, I didn't have it memorized, but yeah, the under 65 with chronic medical conditions don't appear to be in phase 1B. And so, yeah, we'll get this phase done. And then that other bucket of folks, I would think, Dave, that the next phase would fit folks who are under the age of 65, who are not frontline essential workers, who have some type of chronic medical condition. Good question. Let's see here. And I think so that I really didn't want to take a lot of your time listening to me. So unless there are other questions, here's what's going on. So I to this earlier today, I went down and walked through and talked with staff and kind of took a tour, a field trip of our second floor, which we call 2 East, and with our CCU, which is on the fourth floor. Both of those floors have been the floors that have taken care of our sick COVID patients the last 10 months during this pandemic. And I really wanted to have you get to have an opportunity to highlight those units and the work that they're doing. And that I chatted with some of our with our assistant managers as well as our some of our frontline staff, and it was really good. I think you'll enjoy it. Here's the deal, though. We got done kind of later in the morning with that, and to get all that downloaded, and for our able-bodied marketing IT person Matt to get this all ready to rumble, we're not quite ready for it with it yet. Just to show you, as normally I would finish my part of this and then hand it off for you to watch. I just encourage you. I beg of you. It please take a look at this and listen to what these folks have to say about their experience about being part of this, being the front line of this pandemic, and trying their best to care for these patients when we have when this goes live. And Matt is telling me, somewhere around 3:30, 4 o'clock this afternoon, we'll have posted this on our Facebook page, and you can then take a look and watch it. It'll be all ready to go. My apologies, it's not ready to go now. We're learning through this process that I probably need to do these a little earlier in the day or the day before, particularly for these ones that go a little bit longer. So Unless there are other questions, it's going to be a short week live here with you at noon. But I really encourage you to take a chance to later this afternoon or sometime. Oh, thanks, Donna. To take a chance sometime later today or tomorrow to just listen to these folks. Just listen to them and the good work that they're doing. So until next week, I encourage you to watch those videos later today. But until next week, I'll catch you live on Thursday at noon. Thank you so much and take care.